Everyone, good afternoon. And today we are going to talk about perfect case taking in success making. See, many of the times what happens, we have lot of patient and we prescribe good remedies to the patient, and still then we do not get success because what we feel that we have prescribed the best remedy. But remedy prescription depends on what? It depends on your rubric selection, and rubric selection depends on what? It depends on your case taking. So the basic thing is perfect case taking. And in homeopathy, as we individualize the person, as we individualize the disease, we individualizes the case taking. It changes according to the system involved. Thank you so much, Bhargav Phytolab. It's an honor that we are presenting this presentation under the banner AHMA, me and Dr. Hashmi. So this is about my short intro. Let us keep it. Now let me talk about this thing. What is homeopathy? I don't want that bookish language that it is a science which is based on similia similibus currenta. No, it is a wonderful science which based on the natural of similia where we treat the others as we would wish to be treated. Very simple. If you want to earn respect, you need to learn how to pay respect first. If you empathize the agonies of the patient by keeping yourself on his place, by your mind and heart, then only you can understand his feelings and emotion. And this involvement with the patient is only homeopathic. And that's why we say that it is a science of individual. Individualization is the process of differentiating a person of similar from a similar group or a similar person. All human beings are anatomically and physiologically alike. But what is the difference between every person? There is a difference in thinking, reflexes, emotions, expressions, desires, aversions, like, disliking, thermal reaction, dreams, and many more things. And these small things makes every person unique. Even twins are not alike by mind. So coming to what is case taking. Why do we collect the case? Why do we not prescribe directly? Because by collecting case taking, we get to know the person who is sitting in front of you. Case taking is the process of collecting all the facts about the patient using various tools like observation, perception, history taking given by the patient, his family, and later on you do clinical examination. But remember one thing, pay importance to laboratory investigations too, because all these lab investigations are the subjective symptom. So we should not skip them. Now, according to Kent, there are different grades in the journey of cure. First grade is taking a good case. Second is to analyze a case very well. The third grade is would be application of good knowledge and good knowledge of materia medica and to find the simillimum. And the fourth grade would be successful follow-ups. If you have lot of follow-ups like for the months, maybe 10 months, 12 months, 18 months, patient is coming to you, following you and telling you that doctor, I am getting this much relief from your medicine, then only you are a successful person. See, we need to give some time to the patients also, because no disease develop in one night. Rome was not built in one day. So if the disease process takes a long time to establish in the person's body, of course your medicines will take little bit time to show the results. So first of all, be honest with the patient. Tell them that I am now going to do any miracle just now. In acute, we can show the miracle. But what about the chronic disorders? And in India, we are we homeopaths are usually known as the expert of chronic disorders like asthma, skin, allergy, diabetes, and many more. So please be honest with your patient. Hahnemann mentioned in aphorism 5 that a physician must have a complete knowledge of disease process from beginning to end. It helps in individualizing person's symptom from the disease symptom. Generally, what happens, friends? Usually, delegates or doctors ask me during my seminar if we have to prescribe our remedy on the person and his symptoms as per our observation. Then, is there any need to know about the disease? What matters if it is diabetes or asthma or something else? because we are treating the symptoms of the patient. No, my dear. We must know the disease process so that we can individualize the symptoms of disease from each other. We should know which symptoms diabetes have. We should know which symptoms asthma have so that you can individualize them. Later on, you can find the miasms according to them, and then only we can treat the disorders. Because first of all, we need to treat the miasm behind every disease. Individualization is not limited till patients or diseases, but it is there even in a way of case taking. Nowadays, many doctors are using fixed printed prescriptions in other pathogens. I witnessed it. This prescription contains 7-8 different types of remedies. For patient A, upper 5 remedies are good. For patient B, lower 6 remedies are good. Then for patient C, middle 4-5 remedies will do. And in few cases, all the 16-17 remedies are recommended. See, for example, here I have the prescription written by a doctor, and if you can see here, almost these 10 tablets were prescribed to the patient, and later on behind this prescription, this is the back side, almost 17 tablets are there in this prescription, and the patient is quite fortunate in my eyes because her doctor has prescribed her only 16 out of 17. Thank God, at least is spare one. See, by doing this, you are becoming only a prejudiced mind, a good example of prejudiced mind, because you are not thinking out of this prescription. You are not thinking out of the box. And what homeopathy do, we always think out of the box. Is this authenticity to write the prescription like this? It is the biggest example of prejudiced mind. You are going to fit Cinderella shoe mandatorily in every girl's feet. This never happens in homeopathy. Homeopath prepare a proper shoe for individual girl, and this individualization is the beauty of homeopathy. And that's why we say that we cure diseases. We do not palliate it, we cure it. A homeopath, being an unprejudiced observer, as suggested by our father in aphorism 6, do not prescribe what he feels correct, but he gives the patient what the patient needs. Everything is written here on the forehead of the patient. His whole body talks. What only you need, that you need a good eye. You need a keen observation. And if you have the good observation, you are going to prescribe a damn good remedy and providing cure to the patient, not recovery, not palliation. Good case taking is a 50% work done. If you have taken a good case, even if you are not a good homeopath, you got all the chances to cure your patient. Final prescription of remedy depends on totality of symptoms. Hence, case taking in homeopathy is designed as per the involved system of the body. Now let us talk about the psychiatric case taking, because it is little bit different than the gynec case taking. Gynec case taking is basically focused on the organs, and psychiatric case taking is basically focused on the generals of the patient, mental general and physical generals. About mental case taking, we have divided it into two parts, case taking for subjective symptom as well as objective symptoms. Now case taking for subjective symptoms. Few things a homeopath follows. He avoids leading question. We never ask the question like which the patient can answer in yes or no. We maintain good objectivity at all the time. We keep good records, and we inquire about energy, sleep, appetite, thirst, desire, aversion, menses, etc. etc. Even we ask about their clothings. If they like tight clothing or loose, about the question of woolen clothing. Like you can see here, I mentioned in the chart, there is intolerance of woolen clothing. We have 10 remedies. If there is intolerance of woolen clothing, even working with the undressed woolen, then we have the remedy anthracea. And if there is a amelioration with the woolen, then we have the remedy spigelia. See, we apply lot of filters before we select a remedy. If you remember, few years ago, there was Jaspal Bhatti's show on television, Doordarshan, and he had a joke that once upon a time, one MLA got unconscious when he heard the result of election, and a homeopath came to treat him. Homeopath asked his assistant by how many votes he collapsed, whether it is 5,000, 6,000, or 7,000. The assistant said, really, it makes any difference how many votes he collapsed by how many votes? He said, yes, I am homeopath. We have the different remedies for the different votes. See how specific it is. Though people are laughing at us, but we are providing good results and we are creating miracles in homeopathy. These small questions which we ask the patient about his sleep, need, and his appetite and his dreams, it made a bridge of trust between a homeopath and the patient, as no one else ever inquired him about his small but important things. Then he is ready to give us some mental symptoms. You cannot expect first time he is meeting you and he will tell you everything about his personal life. No, for that you need to build a bridge of trust between yourself and between the patient. Later on we interrogate first chief complaint. Suppose if it is headache, then collect all the modalities and concomitants. Suppose if there is a headache, aggravation afternoon, the character of pain is bursting pain, amelioration by sleep, and it is accompanied by, means the concomitant symptom is nausea. Then we have the remedies sanguinaria, sepia, belladonna. See, for every symptom, complete symptom, we have different remedies. We don't give just a painkiller. It can be congestive headache, tension headache, migraine, or bilious headache. How a painkiller can control all types of headache? How a same remedy can treat different people? Treatment can never be generalized, it should be personalized. In homeopathy, we choose the appropriate remedy by paying attention to every small details. See this beautiful photo. Chief complaint, character of pain, amelioration, aggravation, and concomitant. This law is given by our pioneer, Dr. Boning herself. The complete symptom. For the mental symptoms, we make patient to lead. We just pay attention to the first thing they mention. The thing which is near to your heart will be the first to come on tongue. Later on, a homeopath led the companions to add something to get confirmations and contradiction about patient's behavior. If suppose any patient is visiting you for the migraine and he is a known case of diabetes, if you are going to ask in detail, yes, बताइए कब से शुगर बढ़ने लगा, क्या हो गया, कितना रहता है आपका शुगर, the patient will answer you, डॉक्टर साहब वो शुगर को जाने दीजिए ना, पहले आप मेरा हेडेक ठीक कर दीजिए. See, he is more concerned about his migraine. So the thing which is really troubling him will first come on his tongue. So keep patient and listen him. Checking the sensitivity level. Some patient may tell you, when I see a horror movie or an accident or hear about accident, I cannot sleep for few days. That is the symptom. Here we have the rubric, horrible things and bad news affected by. And the medicines are iodine, phosphorus, calcarea, spongia and cicuta verosa. Then later on, checking anxiety is very important thing. Anxiety and fears. Fear has a great impact on our life. It decides your success and failure rate. A homeopath even asks about stage fear, exam fear, and fear of opposite sex, as we have the medicines for that. Suppose anybody has anticipation and stage fright. He is not able to talk on the stage. We have different remedies for that. And if we give correct remedy to the patient by matching his other symptoms and by considering his totality, then we can remove this fear. And today maybe he is a shy guy. He is not able to stand on the stage. But tomorrow we can be a motivational speaker. The credit goes to the homeopath. Then we have the remedy even for the failure in examination. 19 remedies are there. And since our university days, college days, we know that gelsemium and argentum nitricum are really good medicines for this. But here I would like to suggest you one more better remedy, which I have clinically experienced. If any girl is consulting you and she has fear of examination or fear of failure in examination with suppressed menses or irregularities of menses, and all the time she feels that she is under pressure. Why she wants good performance in the exam? Because मेरे पेरेंट्स चाहते हैं कि मैं अच्छा करूं, मुझे उनके लिए अच्छे मार्क्स लाने हैं. Your remedy is folliculinum. Folliculinum is a human sarcode and she is always under pressure. So just think about folliculinum and your patient will get rid from the fear of failure along with the irregular menses. Then we have the remedy fear sex of opposite. If there is just a fear, go for pulsatilla. But if there is a fear along with aversion for opposite sex, go for sepia. Checking for guilt conscious, violence, destructiveness and other things. Anacardium is a violent remedy to animals. They kick the dog, pulls the tail, hair and legs, put some boiling water on animals. There is a joy in cruelty. See how much homeopathy pampers you. We have each and every rubric already present in our literature, but the problem is that we do not read it. If you are a good reader, if you keep on reading good materia medicas or same drug for different materia medicas, then you will become a master of materia medica. Then interrogation about affection is the next step. Few people are affectionate. Really, they feel good or bad, but they are not able to express it. For example, we have two drugs, sepia and oromate. There is affection, but there is a lack of expression of this affection. Then we have the interrogation about emotional trauma and honor wounding. It is mandatory because wounded honor or insult or humiliation feeling have a great influence on the human being's personality and they leave the imprint on your vital energy. They damage your mental plane and ultimately you get lot of diseases. It is said that if the patient didn't cry or laugh in your interview, you did not take a good interview. As a rule, it makes sense. So please ask about the honor wounding. For that, we have these 23 remedies present in our repertory. Later on, enter in the patient side because usually the psychiatric patients do not share anything with you. You have to enter in the patient side like this. When eye is at normal position, it looks like the upper part of the image. And this is the 12 o'clock image. The lower image is 12 o'clock position of the eye. Everybody is divided into two parts. The right one is the father's side and the left one is the mother's side. If it is in the left eye, the pupil is at 12 o'clock position. It is a revengeful feeling or rage inside, an angry feeling against somebody. For example, it could be a maid whom the landlady is criticizing and fault finding. So she comes every day already trembling and says all day she is constipated because she is always under fear. So this is interesting. You can pick up the rubric elements from fright and silent or suppressed anger. And in this case, what could be the remedy? Of course, it is Staphysagrea. This is the share. This is the case from Pierre Smith book. If you see the pupil always contracting and dilating when light is put from the sideways, from here, like this. Such patients have alternating troubles. They have altered constipation and diarrhea, and their characteristics moods are always either up or down. Which miasm has this rubric alternating troubles? Sora. Flat pupil usually indicates dull, emotionless, lifeless person with lacked interest and vitality. Even suicidal tendency can be judged by extra flattening of pupils. This is the flat pupil. So whenever you have the patient, especially if it is the patient of psychiatric disorder, please enter in his eyes and just see through and through. Next checkpoint is sexual desire. A great number of people will perform but not enjoy. Thuja, Medorinum, Staphysagrea or Hyoscyamus will thrive on pornography. Ineffectual or unsatisfied desire is like a burning fire which may create psychiatric disorder. Do you know hysteria may occur from being rejected at commencement of coition, suppression of sexual excitement, sexual excess from lascivious thoughts and even pollution after. And sometimes only a successful coition ultimately relieves the hysteria. And we have this rubric in our repertory. hysteria, amelioration by caution, and only one remedy is there, that is conium. If there is a suicidal tendency, as the patient is rejected at the commencement of caution, and if there is a suppressed sexual desire and a patient has suicidal tendency, then think about the other remedies like Origanum majoranum. It is also a very good remedy. Please read this remedy from Matra Medica. Then ask about family history, because sometimes mental illnesses are present in the family and they are inherited. Then let us talk about objective case taking. Keen observation is the key to case taking, because in psychiatric cases, your observation must be very keen. All the time, patient is not going to share his feelings or emotions with you. Feeling, what will you observe? First is frowning. Frowning related, there are different frownings like this. Frowning related to confusion or anxiety indicates the remedy lycopodium. See, this is the lycopodium frowning. When frowning of firmness is there, then your remedy is Naxomica. If frowning related to total confusion with delayed response, your remedy is Helleborus. Because thinking is the most laborious job for Helleborus. They are not able to think. Way of answering. The way patient answer is very important. Zincum and sulfur repeats the question before answering. Reflect a long time before answering. As I already said, Helleborus. Cries when they talk about their symptom. Which remedies? We have sepia, pulsatilla, medorinum, and calicar. And cilicia is the confirmed symptom of cilicia. She will always cry while explaining her symptoms in your consulting chamber. Then even sarcasm. You have to observe whether patient is sarcastic, is he mocking somebody else. An experienced homeopath perceives it whether the patient is making sarcastic remarks about people. And see the beauty of homeopathy, we have this rubric in our repertory, mind, mocking, sarcasm, and we have at least 41 remedies for that. At least we are helpful to such personalities. They are really critics. Then laughing also makes a difference. Anacardium has a mean laugh. Lycopodium has a fake smile, जिसे हम कहते हैं झूठी हंसी. झूठ मूठ हंसते रहता, पार्टी में लोगों को देख के झूठी हंसी देते रहता. Then we have the crocus. Crocus laughs at any stimulation. It is just an explosive laughter. See, this is the crocus that I was there. Why crocus laughs like this? Because crocus has a strong syphilitic background. Then weeping. The different way people weeps. Natremure just get into himself. Ignitia usually is like a pump, spasmodic weeping, and pulsatilla weeps very gently. Now I am going to share two small clips. One about the weeping, one is from Natremure and second is from Ignitia. Just observe. This is Natremure weeping. Though she cut her vein, she must be suffering from severe pain. Still, there is no sound at all. Natremure keeps everything inside him. Now just enjoy the Ignitia weeping.
उसने मेरी आत्मा को छुआ माँ, उसकी आंखें मेरे रगों में बेतहाशा दौड़ रही है और हर बात मुझे देखती है. मुझे दो हिस्सों में मत बांटो माँ, मैं उसके बिना नहीं जी पाऊंगी. मैं सिर्फ उसकी हो सकती हूँ. This is our Ignitia weeping. Loud and spasmodic, bumping. Ignitia does everything loudly. Homeopathy says the attention to the smallest symptom can solve the biggest problem of psychology. Now, let us discuss the art of case taking in gynecology and obstetric cases. It is something different than the psychiatric cases. See, we are not going to focus on the mental plane here first, because we are going to focus on the organ first, and we are considering physical general here. Woman is the half of the population of this planet.
And as you all know, there are different miasms. So we will talk in gynec case taking regarding to every miasm. First of all, ask the patient about the menarche. Ask if the menarche was normal, was at normal age, was it early or delayed. Syphilis getting hold overall on our lives. Nowadays, we see girls of 9 to 10 years of age getting menarche. This could tell us about the precocity in the patient too. This is definitely syphilitic tendency. It can be delayed also in psychotics, not getting till the age of 16 to 17 years. First menarche late. Then normal soric get it at the age of 12 to 13 years of age. Then ask about menstrual cycle. Ask it is whether it is regular or irregular. How many days cycle she has. Is it exactly 28 to 30 days or 35 days or 20 to 21 days cycle? Every detail of her menses is going to lead us to the lurking miasm in the background. Soric female will have normal regular cycle with little delay or small variation here and there. Psychotic will have too much delay by months or weeks or slightly early. Syphilitic will have variable menstruation. It never comes on time. It is delayed too longer, amenorrhea for 6 weeks or too early, menses every 15 or 10 days. It can be absent for months together. Then ask how many days do her menses last. Inquire about quantity, whether it is heavy or scanty. Then you will understand, you will come to know that patient has menorrhagia or oligomenorrhea. Then soric female would have normal and same flow during day and night. A psychotic female will have more flow during day. Syphilitic female will have more flow at night. Flow can be more on slightest motion or jerk. Then don't forget to ask about the character. Ask directly what is the color of the menses because it makes a lot difference in the remedy selection. Ask about the character of blood, whether it is thick, clotted, thin, watery, dark brown. Normally, a female should get bright red blood with few clots. This shows the normal level, the normal menses, and it will not have any odor. This is the normal menses color. If the female has bright red but heavy bleeding, we can think about remedies of hemorrhagic diathesis with bright blood like phosphorus. Then we have ferrum phos, ipecac, sabina, and belladonna. Here we can see this is ipecac menses. When a female gives us a history of dark clotted black blood, it shows her psychotic tendency of clotting due to excess fibrin, black due to excess pigments, thick blood due to excess gluten. It may have mild odor. It can also indicate the group of remedies, especially Ophidia like Lachesis, Crotalus horridicus, Crocus sativa, Platina, and Hamamelis virginica. See, you can see here, dark. Now, syphilitic female will have excessive bleeding causing fainting. Bleeding is profuse, copious, gushing, excess clots, membranous, black tar-like, stringy. It looks like a Turkish rose color. It will have extremely bad odor, sometimes cadaverous odor. Even you will see the leucorrhea of syphilinum remedy. It is green, acrid, and soaking the napkin. Gushing. The menses can be acrid, which corrodes the cloths. Such indication also lead us to the remedies like creosote, carbovage, sicklecor, lilium tea, and carboanimalis too. We can see here the syphilitic menses. Then inquire about pains. Soric female generally do not experience any pains or may get mild dysmenorrhea. In psychosis, she may have dull aching pains. The pains in psychosis may be present for the first 2 days or even before menses, but they relieve by doubling, bending, warm application, and as the flow increases. Syphilitic pains would be excruciating, tormenting, unbearable with anger, anguish. She may roll down with pain, has to hit. Extremely dysmenorrhea associated with severe vomiting or severe headache. Then ask about the characteristic complaints. Normally, a soric female may not have any complaints before, during, or after menses. Whereas some females complain, Doctor, I know when my menses are due. I start realizing it 7-8 days before menses. My breasts get engorged. I can't even touch my breast. They are so painful to touch. My legs pain and body swells. There is water retention. My whole family comes to know that my menses are due as I start shouting at everyone without any reason. I get into fit of anger, depression. I start crying without any reason. But as soon as my menses appear, I'm a different person. I feel so fresh and energetic, lively, all my pains go off. In such cases, with the other totality of symptom, please consider the rubric menses during amelioration from the generals chapter, and we have 49 remedies for this. There is one more remedy. This is my clinical experience. If there is a water retention, whether it is due to irregular menses or delayed menses or due to menopause or due to kidney disorder, the best remedy whenever you have the hormonal imbalancing along with water retention, please prescribe cortisonum 200 once in a 15 days. 2-3 doses will help you. If suppose we have this type of symptoms, then we know that for sure we are dealing with the remedy of Ophidia group or Zincum because they feel better by discharges. If you have a female complaining of severe dysmenorrhea with vomiting or fainting, menses smell a lot, stains the cloth, sad and melancholic during menses, otherwise she is fine, can think about magnesium groups of remedies. Think about magnesia. Magnesia is even a better remedy for psychiatric disorders also. If patient has absent father syndrome, think about magnesia carb. If patient has absent mother syndrome, think about magnesium mule. If there is a strong desire for support from the family, then think about magnesia salt. Magnesia salt work as a diuretics too. If patient has a less urine or retained urine in kidney disorder, just prescribe magnesia salt 12 and you will get better results. Any peculiar symptom during menses also can lead us to any particular remedy. Behavior of a female around and during her menses gives us many clues for similima. For example, if there is anger during beginning of menses, if there is anxiety, anger with during menses, we have different remedies. If there is a vision, aggravation of vision during menses or aggravation impaired hearing during menses, then we have different remedies. If there is a copious urine during menses or difficult respiration during menses, we have different remedies as I mentioned here in the chart. But the important thing here which I want to stress here is that you need to inquire the characteristics symptom from the patient. Just ask the patient, कुछ अलग होता है क्या पीरियड में? पीरियड के पहले, पीरियड के साथ या पीरियड के तुरंत बाद में 4 दिन में कुछ अलग आप फील करते हो क्या? अगर करते हो तो बताओ and you will get the characteristic symptom. Then ask about menopause. If menopausal woman asks the time of menopause, normal, early or delayed. Like early menarche, we have females coming up with the early menopause at the age of 35 years. So it shows the syphilitic trait and it is known as menopause precox. Some psychotics may bleed till the age of 50 to 55 years and they have regular menses without any trouble. Then don't interfere with the medicine. Let it go naturally. Soric females may not even realize any symptom and psychotic may go into fit of anger, water retention, increase in weight, etc. etc. Syphilitics may go into rage, lot of menstrual irregularities, severe hot flashes, one moment feeling hot, wants AC. The other next moment she feels chill and she just stopped the AC. They may develop hysterical behavior or go into depression. Now don't forget to ask about the obstetric symptoms of the patient because it has a great impact throughout her life, because pregnancy is the essential part of any female's life. That phase of her life can tell us a lot about the female. How was the pregnancy? Was it uneventful, normal, and natural? Or did she have any bad events during that period? Don't forget to ask about history of any emotional separation. Usually what happens, doctors ask so many things to the question, so many questions to the delegate or patient, and they ask, how was your mental status during pregnancy? The lady answer it. Even for children history, we ask the mother about her mental status during pregnancy, and she answered it. But when we collect the history, we do not know what to do with that symptoms. Why we are collecting it? Just because our stalwart suggested that? No, you need to understand this, because you have to explore whether there was any disorder, physical or mental, during her pregnancy or even 2 years before her pregnancy. Because such disorders, or the history of taking medication, drugs, even the nasal spray, anti-allergent, antidepressant, anticonvulsant, or contraceptive pills, has their imprint, molecular imprint on the vital energy of the lady. And with this molecular imprint, when she deliver the child, it automatically gets transferred from the mother to the child. And that's why we get the cases of autism, ADHD, or mental retardation. In such cases, where all the both the parents are absolutely normal, still you are getting the child who is mentally retarded. So it is very important to inquire about these small but important questions. Then ask about any pathology. Was there history of habitual abortion or miscarriage or ectopic pregnancy? This can tell us about the syphilitic trait, and we can prevent it with our medicines for the next pregnancy. Then how did she deliver the child? Was it labor? Was it a normal labor? Or was it a cesarean section? Was it vacuum assisted birth? Or was it forceps assisted birth? Is the answer clear? Yes. If it is cesarean section, vacuum assisted birth, or forceps assisted birth, ultimately we are disturbing the natural labor. We are disturbing the normal process or natural process of the birth. We are mechanically assisting the child. And here we can get hydrocephalus or cord round the neck or neonatal asphyxia at birth. For that, we need to be prepared. So, inquire everything. Then ask the questions related to breast and lactation. How was the history of breastfeeding? Did she lactate well? Some females don't get milk at all, or some may get a lot even after 1 and 2 years too. Any history of breast abscess during that time, that can give us a clue of suppurating tendency in a female. Any history of hormonal pills? As I just mentioned you, why do we ask this question to our patients? Inquire about birth control measures or hormonal pills to extend menses taken by her, because it makes a lot difference in the natural vitality of the patient. It gives us the history of suppression at the hormonal level, and we can check if any problem has started after that. See, whenever any patient approach you, we have different hierarchies to apply. There are levels of hierarchy, and the first level for any disorder, if you get any disturbances in endocrinal axis, then apply your attention first on the endocrinal axis. Whether the patient is visiting you for neurological disorder or neuropsychiatric disorder or diabetes or any bone related disorder. But if there is any endocrinal dyscrasia, first inquire it and concentrate there. Just treat or detoxify that part from the body and vitality of the patient. Remove the molecular imprint on the from the vitality of the patient, and then put the constitutional remedy. For removal of this molecular print, we have the nozodes. Use nozode to open up such cases in hypotensive, and later on put your constitutional remedy. You will sure get the success in such cases. Now I am going to show you a very beautiful video of my patient. I just want to share this video with you just to show that Every lady who is consulting you is not the gynec case. So directly don't ask about her menses or anything. If suppose she is consulting you for some other disorders, some psychiatric disorder, then your questions will be about her mental and physical genders. It won't be directly on the organ. Don't focus directly on the organ or menses. Maybe later on in the course of disease, you are going to ask the question, but that will be in the second or third sitting. But in the first sitting, just inquire about the psychiatric plane. If the patient, though she is a lady, but she is not suffering from gynecological disease, then your focus of case taking will be different. Now, this is a lady, a middle-aged, visited me with her husband. She has been tormented a lot by her family. They consulted me for her aggressive and grotesque behavior. While in conversation, she told me, the whole world is just a fantasy. I have my God inside me. I went on the moon to meet him. People who tormented me, I gave them the taste of their own medicine. Whatever I do, love or anger, is my right. I am lawyer, I am judge, I am everything. Just enjoy this video.
है ना, क्या बाहर का देखते हैं, अंदर ही बैठा है, अंदर बैठा है, बाहर क्या है, सारी दुनिया मायाजाल है।
सही बात है, वो बिल्कुल बराबर।
मेरा तो पांडुरंग है मावली, मैं मिल गई उससे, मिल चुकी उससे। मिलने गई ऊपर, चंद्र पे मिल गए ऊपर।
अच्छा, ओके।
मिल के भी आ गए, दर्शन हो गए, सब हो गए। सबके लिए, सबने मुझे जो दिया ना,
उसके बाद में अभी
जिसने मुझे जो दिया उनको वही सब वापस कर दिया, सब वापस एकदम से पूरा के पूरा। मेरा अधिकार है, मैं गुस्सा करूँ प्यार करूँ, दोनों कर सकती हूँ मैं, मेरा अधिकार है। दिस इज माय, क्या बोलते हैं इंग्लिश में, राइट, दिस इज माय राइट।
यस, यू कैन बी अ लॉयर। आप बहुत अच्छे
वकील भी हो, जज भी हो, मिला भी हो, सब।
Yes.
This is my right. मैं नहीं करूँ तो कौन करूँ?
In this case, are you really going to ask the first question regarding menses? Seriously? No. Here you will start with the psychiatric plan. Homeopathic prescription is based on the unique, rare, uncommon symptom of patient as it predicates the man, the person, not the common symptoms of the disease. For that, we need to individualize disease symptoms from the person symptoms. Homeopathy does not treat the disease, it treats the patient. In the other words, it individualizes. Homeopathy alone knows and teaches that the cure is to be effected only by means of the entire force still existing in the patient. When a medicine perfectly homeopathic to the present scenario and administered in the proper doses causes the force to exert its curative activity, and ultimately we get cure, not the recovery. Recovery is just temporary, going back to the healthy state, but we need cure, not the recovery. Homeopathic is a therapy that helps systematically to unblock a chronic disease with the remedies which are proved on healthy human beings, and hence it is an extraordinary pathy. So thank you so much everyone for your patience listening. If you have any queries, you can mail me here or you can directly ask here, but still note down my mail ID. Maybe I may not answer so much questions. Later on you can ask me anytime. Thank you so much.
And thank you, Dr. Kavita. Yeah.
Wonderful, wonderful.
जो
आपने वीडियोस यूज किए और जो आपने जिस तरह सिंपलिसिटी से आपने बताया, इट वाज वंडरफुल, डॉक्टर कविता.
Thank you so much. Is there any question?
Sure.
Yeah, please.
Any questions, audience? You can just type in the chat box and we will be asking Dr. Kavita. What is the medicine prescribed? Dr. Sai is asking. Dr. Sai, which?
See, in this case, what medicine I prescribed was not important. I gave her anacardium first for the to stable her mentality. But here I just show this video just to show the difference between psychiatric case taking and gynec case taking. Because sometimes what happens, whenever any lady patient visits you, usually a homeopath keep on asking the question related to the gynecological part. So please don't do this. ask the question related to the system involved in the disease of the patient.
Okay. Okay. Can we get this webinar on YouTube? You guess my number. You can आप जो भी
It
है
is
you
on
will.
Facebook.
It is on our Facebook. I संपर्क page. आप उसको like करिए. You will get this webinar. How could we adjust our anger even in the worst situation? And
See,
Vinod Bhagat is asking.
see, we do
And
not.
one more question is there, doctor. One more question is there.
Is it similar?
Yes.
Okay.
Okay. The question is how could we adjust our anger even in worst situation? And second is why, ma'am, we should treat first hormonal problem then other.
Okay. So, Dr. Vinod, first I'll answer your question. How could we adjust our anger even in worst situation? There is no need to suppress your anger. If you are angry, it is a natural instinct. Whenever we suppress our natural instinct, ultimately we land in the diseases. We have a great and big rubric in repertory suppression of anger or elements from suppression of anger. Why do you want to suppress your anger? Just keep calm. Do one thing, just keep calm, count 1 to 10, and later on think the sequences. If I will say anything wrong, how will it get returned to me? Because whatever you are giving to anybody, it will come back to you. हम आसमान की तरफ मुंह करके जब थूकते हैं ना तो पहले हमारी मुंह पर ही गिरता है, ये कहावत है हिंदी में. So try to control your anger, don't suppress it, express it, but in a good manner. And the second question was
from ये कोई honor and light है, इनका question है why, ma'am, we should treat first hormonal problem than other.
See, until and unless you make endocrinal axis free, you are not going to treat the person in a whole. Because see, in endocrinal axis there are different glands: pituitary, then thyroidinum, then our two breasts, our ovaries, and in male testes, and then later on we have adrenal cortex, pancreas. All these are the glands, and which are hormonal glands. They secrete different enzymes and hormones. If there is any blockage in your endocrinal axis, you are not going to treat the person anywhere in your life. If suppose you are handling thyroidism and you are giving the remedy only for thyroidism, the patient will definitely land in diabetes after few years, because these both are the metabolic disorders. So to balance the metabolism of the body, you need to first clear the endocrinal axis. Whether the patient is visiting you for any other disease, that doesn't matter. So please remove the molecular imprints of such bad remedies from the vitality of the patient and then put on your constitutional remedy. You will definitely get the results. This is my clinical experience.
Ranchor is asking medicine for vaginal warts during menstruation.
See, my dear friend Ranchor, there is a very great remedy for vaginal warts, and please give it in a high potency, because vaginal wart always show this psychotic tendency. And don't go for thuja as usual homeopaths are doing. Your remedy here is medorinum 10 ml. Give in the aqua dose, put 1 drop of medorinum in 100 ml of water, and suggest the patient to take one drop morning evening for 8 days, 10 days. No matter, because it is in the aqua dose, so it won't create any harm to the patient. And just wait, tell the patient to reply you as soon as she will start suffering from any itching or any loose motion or any type of skin eruption or any coryza. If the patient says that, doctor, I am having anything one of this, start the water solution, stop the water solution, and just prescribe the SL to the patient and wait and watch and see the result in few months.
Okay.
There was one good question, sir. Sorry to disturb you. It was about autism, but I cannot read it in my chat. It went upside.
I'll just see.
Yeah,
okay.
please.
One question from Simran Arora. If the female has been taking progesterone only pill and not estrogen, what would the impact be same?
Yes, of course, it would ultimately harming. See, it is harming your vitality. Yes, you know, we have the remedies polycontraceptive course. It is known as polycontraceptive course. This is the homeopathic remedy, which is very useful, and in Europe they are using it at very good level. It is not present, presently we are not getting it in the India, but we have this remedy to detoxify the body of the patient. And it really gives a good result in cases of sterility.
Okay. And Dr. Seema is asking, please suggest any book for miasmatic differentiation in obstetric and gynec cases.
Right now, I am writing this book on the same topic. Very soon you will get that. But till then,
Wonderful.
keep on reading. There are lot of books. But I would like to suggest you one thing, that you should read every drug from 5 to 6 materia medicas. Don't stop with one materia medica. Don't stuck
Okay.
yourself here.
Okay.
Ma'am, the question was by Dr. Kavita Chandak. She wants to know there is a case of autism of 6-year-old boy. Mother was having suppressed emotions during pregnancy. Now she wants to know how to start a case constitutional medicine to help child.
See, Dr. Kavita, there is a problem if you have such cases and there is autism. You know, autism is a neuropsychiatric disorder, and sometimes patient usually born with the assistant delivery, like forceps delivery or cesarean section. And please inquire with the mother, was there is a cord around the child, neck around the child, or was there is asphyxia, neonatal asphyxia, respiratory distress syndrome. First of all, inquire about this thing. Second thing, if you want to start the remedy with constitutional one, my suggestion is that to open up such cases, we really need first to use the nosol in high potency. Why? Because always such cases have the molecular imprint of genetical factors along with the environmental factors. What can be the environmental factors? The food taken by mother, the nasal spray used by mother, the antibiotics or anti-cancerous drug or antidepressant remedy, tobacco, smoking, alcohol, all these are the environmental factors. And they all have the some molecular imprint on the constitution of the mother. And she passes that all imprints to the child. First of all, we need to clarify and detoxify the vitality of the child. And later on only you will get the correct picture of the child. So first of all, you just see which miasm is the dominant in this case. Suppose because in autism usually it is a multimiasmatic disease, but tuberculum miasm, tubercular is the dominant miasm. But it is up to you because you are observing the patient. So just see which miasm is the dominant here. Then apply the nosode regarding to that miasm in high potency, and later on after 15 days collect the true picture of the patient and then start with the constitutional remedy. For further knowledge regarding autism, I have a video on my YouTube channel regarding autism. If you would like, just visit my channel. Its name is Dr. Kavita Chandak, Nagpur. So you may get more idea because I may not explain everything here because I have to answer other doctors too. Thank you for understanding there. Any more question, doctor?
Yes. We have questions. This question is from okay, a lot of questions. New questions have come.
See, they can mail me if I won't be able to answer.
Yes. I think we'll take one more question, doctor, and then we will end the session. And then we can share your email ID and they can ask you over there. Dr. Meenakshi is asking, if young patient with low AMH, what can be given? History of chickenpox, after which amenorrhea?
See, history of chickenpox here matters. You need to put some nosode like variolinum or vaccininum for this. First thing. Second, if there is low AMH, then you need to go with the constitutional remedy because there is no specific remedy in homeopathy to increase the AMH. It is a hormone. But of course, you can think about obininum, lateral, uforinum we have, and we have folliculinum. These all are the ovarian extracts. You can think about this remedy along with your constitutional remedy.
Okay. Right. Dr. Kavita, do you have time? Should we ask?
Yes, we have 5 minutes. Please keep on asking.
Okay. The next question is, what are the nosodes given in thyroid disorders? From Fatima.
See, there is no fixed nosode for every patient, my dear. See, homeopathy is a different pathy, and I just represented the whole presentation regarding individualization. That you have to individualize according to each patient, Fatima. But and please don't keep on putting the sarcothyroidinum everywhere. Please don't do this. And usually in thyroid patients, we do not prescribe tuberculinum because it may cause further reduction in the weight. Already the hyperthyroidism patients are lean thin and they are losing their weight. If you are going to put tuberculinum here, the patient will lose more flesh. So please don't use tuberculinum in such cases. Later on, you can decide the nozzle as per the individual patient.
Dr. Rhea is asking any medicines which can be given to control heavy, prolonged, and profuse menstrual flow in a uterine fibroid case.
Why any medicines? We have lot of medicines for that. But ultimately, it depends on the patient. Just inquire about the color. If it is bright red and constant flow, heavy menorrhagia with uterine fibroid, if it is bright red, think about Sabina. If it is bright red along with the clots, think about Sabina. If it is just bright red, think about Ipecac. If it is dark red but thin bleeding and constant flow is there, then think about sickle core. We have different remedies. And if it is bluey, sticky, like tomato sauce, dark brown, then you can think about sulfur. Sulfur is also a good remedy in such cases.
We'll take the last question from Dr. Seema Sultana. What is the difference between supposition, anger, and express in good manner?
See, suppress anger, she asked.
Yes, yes. I think it was suppression only. Supposition.
No, it is suppression maybe.
Suppression. It is spelling mistake.
Okay. See, if you are suppressing anger, ultimately you are throwing the dirt inside your body. You are making yourself dustbin. Understood? And if you are throwing the anger outside, not throwing the anger, just express the emotions. But don't be too much hypersensitive and be offended always. Keep patience before replying. Just listen everybody patiently, keep patient, think the consequences, and later on reply. So it will help to express your emotions. And then you will be no more dustbin. Understand? If you will suppress everything inside, you are dustbin. If you are expressing in a good and well manner, then you are a good person. And being homeopath, we must learn this art how to express anything in a good manner. It is a part of our profession, dear.
Wonderful. I agree. I agree,
Yes.
Dr. Kavita.
Yeah.
Right. Dr. Kavita, thank you so much. It was a
Thank
wonderful
you,
presentation.
everyone.
Thank you for
Everyone.
coming.
Yes.
Yes.
Thank you, Dr. Negi. Thank you, Ashmit. And thank you, Dr. Obed Hashmi. And maybe in future we can take some webinars related to infertility or anything else. But till then, please
Absolutely.
keep on watching my videos on YouTube and subscribe my channel so that you will get notification for the further videos. And really thank you for your patience listening. And I would love to answer all the questions. If you have any question, you can send the mail to Ashmit or Dr. Negi or directly to me. I will definitely answer. I promise. Thank you, everyone. Bye.
Thank you so much.
Thank you,
Bye.
Dr.
Bye,
Kavita.
Dr. Kavita.
Thank you, Dr.
Thank you, Beta
Thank you.
Ashmit. Bye.
Thank you.
Thank you. And all those who have joined us, I'll be sharing the WhatsApp link with all of you. You can join our WhatsApp group, and मैं आपके साथ में WhatsApp group का link share कर रहा हूँ. Come and join us, and you'll be getting updates about upcoming webinars and many other programs that we do. Right now, we are running a wonderful campaign with the name Bhargava Garcinia Cambogia 10,000 Steps Per Day Challenge. So if you want to participate in that challenge, you can just join our WhatsApp group, and we'll be sharing the details over there. It's a wonderful challenge that has been taken up by the doctors. All you have to do is walk 10,000 steps per day and tag five of your friends on Facebook and ask them to participate in that challenge. It is our initiative to make people aware about obesity and how walking can help them to control their obesity. So thank you so much for joining us. Thank you, Dr. SS. Thank you, Deepti Shah. Thank you very much, Dr. Kranti. Thank you so much, Dr. SS. If you can just share your name, Sangavi. Thank you,
Dr. Shahla.
Okay, Dr. Shah. Thank you, Dr. Vidhi. Thank you, Sai. Thank you so much, Anjali Mubarak Ali. Thank you so much for joining us. It's because of you people that our webinars are appreciated. And I would, okay, Dr. Shala Sultana ji, thank you so much. Sumant Kumar ji, Mubarak Ali, thank you so much. Vishal, thank you. I would request all of you to please join us on our WhatsApp group. And if you want to conduct a webinar on any topic of your choice, please get in touch with us. We'll be more than happy to host you. No, Vinod, Vishal, and Parth Giri Goswami, thank you so much. हाँ, एक और चीज है, we already have Avantika, thank you. We already have a wonderful initiative with the name of Homeopathy Works. तो अगर आपके पास bone related disorders, obesity management and skin disorders पे कोई भी आर्टिकल या केस स्टडी है, आप प्लीज हमें हमारे WhatsApp नंबर पे आप हमें बताएं, and we will share the link with you where and how you can submit your articles or you can submit your case study, and we will be publishing them, and वो publish हो करके all India उसको हम circulate करते हैं. Thank you Dr. Lalit. So I would request, अगर आपको webinar लेना है या आप चाहते हैं where can we share our problem here. I didn't get you Vinod, मुझे नहीं सुना आपने क्या लिखा, sorry. So आप लोग अपनी केस स्टडी या आर्टिकल आप लोग शेयर कर सकते हैं. यू कैन शेयर. अब मैं फिर से एक बार व्हाट्सएप ग्रुप का लिंक शेयर कर रहा हूँ, आप हमें व्हाट्सएप में ज्वाइन करिए. एंड अपार्ट फ्रॉम गुड मॉर्निंग एंड गुड नाइट मैसेजेस, वी डिस्कस एवरीथिंग अंडर होम्योपैथी, एंड यू कैन ऑल जॉइन अस, बी अ पार्ट ऑफ इट. एंड वहाँ पे हम शेयर करेंगे कि आप कैसे अपने आर्टिकल्स या कैसे अपनी केस स्टडीज को सबमिट कर सकते हैं. सो थैंक यू ऑल हु हैव जॉइंड अस. Shmeet.
Yeah, thank you so much. All the doctors who joined us today, this iSampark webinar is now a regular process for all of us. After today, like weekend is coming, so we don't have any webinar at that time. So on Monday, we have another webinar, and Dr. Chakshu Mishra ji is coming to take second session with us. So we are looking forward to see you all on Monday as well. And meanwhile, in case you have any queries related to webinars or our products, we have the entire range of homeopathic medicines. In case of any requirement, we would be very happy to assist you. Our numbers are there on your screen. My number and Mr. Rajneesh's number is there. So you can just take the note of it, and we would be really happy to help you out in case of medicines or any other activity related queries.
What will be the topic on Monday? Vidhi Joshi is asking.
Let me tell you. It will be related to back issues.
Wonderful.
Interpretation of MRI in back pain considering homeopathic approach. So it is a very wonderful topic, very interesting, and I think you all would be witnessing very good enlightening sessions. So do join us on Monday. Please arrange a talk on endometriosis. Taken your point, Madhav ji. Definitely we shall arrange a
Madhav,
session
please,
on this.
I would request if you have some good speaker on this topic, let us know, and we will definitely ask our doctors. But अगर आपके पास कोई है जिनको आपको लगता है कि he or she can speak very well on this topic, please share their number, and we will get in touch with the doctor, and will ensure that they come on our platform.
We are planning a very good session on 31st of August with a very leading doctor of Bangalore on the topic of infertility. So that is going to be one topic. That doctor has treated more than 3,000 patients of infertility, and he has got a world record. So I'm not sharing his name, Abhi. We'll let you know about the name of the doctor and the topic very soon. So a lot many webinars are there in which we have planned in the coming days on the similar topics that you look forward to. So I think thank you.
Yes,
Yeah,
thank you everyone for joining us,
session.
and we would be closing the session now, and we have shared the WhatsApp link there, and उसमें अगर आप WhatsApp में देखेंगे तो वहाँ ग्रुप में एडमिन में स्मित और मेरा नंबर है, and you can add that number. So thank you everyone for joining us. I'll just close the session now.
Thank you.
Ishmeet has unmuted. अगर आपको किसी को कुछ बोलना है, you can
You're
of
most
course
welcome.
अगर आपको कुछ बोलना है, you want to share your thoughts, you want to share something. Right, Ashmit, I think I'll close the session now.
All right, sure. Thank you so much. Thank you, everyone. Have a good evening to all of you. Thank you.